The number of people getting the COVID-19 vaccine is creeping up, but that number doesn't tell the entire story. When you look at the individuals who make up the data, well, the picture of a racial divide emerges. Laura Jarrett has details.
Rossi is a small family-run pharmacy in Brooklyn, but its modest frame belies the heavy load it's been carrying for the last 4 weeks.
Some of us were just really breaking down from the stress.
After a mountain of paperwork, the Moderna vaccine finally arrived. And since then, Rossi pharmacist Ambar Kalisker says the shop has been overrun with appointment requests.
Our rollout plan went out the window.
Kalisker's family has owned Rossi since the early 1990s. And he says he noticed his usual customers who live in this predominantly Black and Latino neighborhood weren't the ones scooping up the slots. Who was coming?
Mostly patients from Long Island, Manhattan, Westchester. We can kind of very clearly tell who's here for the vaccine, who's here for normal pharmacy business.
So how do you know?
They're white and they look confused.
Rossi is like many other pharmacies and clinics now on the front lines of an equity crisis when it comes to who is receiving vaccines in such high demand and short supply. In New York City, critical data is missing on a little over 300,000 people who've received one dose of a vaccine but have no reported race or ethnicity. And in the available data, the racial disparities are staggering. Out of roughly 300,000 residents who've received at least one dose so far, 46% were white, whereas only 12% were Black, even though Black people make up nearly a quarter of the city's population. And nationwide, the CDC says Black and Hispanic people are almost 3 times more likely to die of COVID-19 than white people. So how is it that nearly 2 months into the city's vaccination effort, the people who face some of the greatest risks from COVID are still largely left behind when it comes to getting a shot?
There is some hesitancy, but I think beyond that, it is concrete access.
Public health experts and advocates like Ivelisse Andino say the first problem is the way most appointments are booked online.
The challenges are for folks maybe who don't have access to a computer, who don't speak a language. It's really challenging to find this place, do all the things that I talked about, sign up, and get here. Beyond that, there's a lot of eligibility requirements.
Then there's the issue of where to go for a shot. State and local leaders have promised more efforts to reach minority communities and point to mass vaccination sites like this one at Yankee Stadium that's limited to Bronx residents, but it's a frustrating solution if you can't get there.
This site at Yankee Stadium isn't the most accessible to folks in the North Bronx. Beyond that, right, the taking off of work, coming in during the middle of the day, that's not, childcare. We're asking people to come to a center and get what they need instead of meeting them where they are.